All right, good morning, everybody. Let's make a start with regards to our discussion today. So, what we are looking at today is learning outcome three. and we're obviously studying the first unit, which is structure and overview of the health and social care sector. Now, today's learning outcome is focused on something that we should all be very curious about because if you're doing this course, you would be looking at obviously different career options and obviously evaluating your skills, your qualities, your interest, and then wanting to see which is the best, job or career option I can take up within the National Health Service or at least within the health and social care side of things. So this learning outcome today is going to be focused on understanding the different areas of specialism within health and social care. So we talk about doctors, we talk about nurses, we talk about physiotherapists, we talk about dinner ladies, we talk about healthcare workers, healthcare assistant, people which work within the A&E. You look at lots and lots of different careers essentially within the NHS, things like pharmacists, dentists, people who manage practices and you know help out in probably research areas or essentially look at midwifery. There could be psychologists or people which help out primarily for therapy. All these professions, all these areas are specialism areas within health and social care. Now, we'll look at a bit of an overview of this learning outcome. And interestingly enough, what we are going to do is obviously look at a particular website which will allow us to explore some of the career options. And this is a part of an exercise that I would ask you to undertake in order to study this learning outcome. Now, there are three assessment criteria that we're going to cover. So, obviously, our session is going to be hopefully shorter today, which would include the first one, which talks about analyzing the different specialist areas in health and social care. Now, there are 350 different areas in health and social care. So we'll not be looking at analyzing all of them. And what we'll be looking at is a few main areas, which if we draw some inflection into our discussions that we did in learning outcome two, we looked at a lot of regulatory bodies, which basically are bodies which lay down standards, procedures, and look at the evaluation of quality and delivery of service within the sector. So things like the Nursing and Midwifery Council, we look at the Journal of Doctors Association, we look at CQC. So the idea here would be to try and look at those specialist areas in which we are able to see some regulatory authority like the healthcare professional body HCPC. So the idea here would be from the website, which I'm going to show you, the NHS website. Obviously, there are 350 careers, and we look at some of them as specialism areas. So we are not going to look at individual jobs, but we're going to try and divide them into areas of specialism. So things like pediatrics, geriatrics, maternity, mental health, social care, and within those, there are various options in terms of careers that you can look at. The second one goes into a bit of detailing. So first, at the high level, we'll understand the specialist areas. So when I talk about pediatrics, when I talk about say maternity, so maternity would cover area like nursing, midwifery. It'll cover areas which are related to the wider healthcare team, for example, or doctors in particular and allied healthcare professionals who would be at some stage involved within the process of the maternity, as an example. In the second assessment criteria, we are going to go into a bit deeper. So from specialisms, we'll go into the detailing of these specialisms. So if I talk about, say, for example, medicine, within medicine, we'll go into careers like doctors, and we'll look at nurses, we'll look at physiotherapists, we look at specialists or consultants, essentially healthcare workers, social workers, and people who essentially provide and deliver social welfare care when it is led through the community services within our community centers within our communities. So here the idea would be to go a bit deeper into the specialisms and pick out a few professions which would give us a good idea in terms of what are the various professions available. So first is specialisms, basically the sectors within health and social care, and then go into detailing of professions. Now, in the merit criteria, we're looking at outlining the access to professions is regulated. So here we're going to be looking at some of the regulatory bodies for each of these professions that we discuss. So when we talk about, say, for example, doctors and nurses and dentists and healthcare professionals, what are the regulatory bodies which basically um, uh, kind of lay down, I would say, the foundation, or the basic rules and regulations of practices and procedures, quality related procedures within those professions. So one such example is, say, for example, Nursing and Midwifery Council. We look at the healthcare professional body at CPC. You look at Journal Medical Association, which is for doctors, GMC. So those are the bodies that we are going to look at in terms of their role and how do they help in actually regulating these professions. That is what we're going to be looking at, in this learning outcome and the merit criteria. So as always, what I would suggest before I start the session, if you're not asking any questions, please keep your mics muted. Ensure that yeah, go on. So please ensure that you are, muting your mics, and that would help us in reducing the background noise, because some of you at a later stage might also be listening into the recorded session, so it will be clear. And if you do need to ask questions, feel free to unmute yourself or ask a question through the chat route. So let's begin with regards to our discussion on Learning Outcome 3. And what I will do is basically switch you over to the presentation that we're going to use to discuss the content today. So as I mentioned to you earlier, these are updated presentations which are slightly more structured and to the point in terms of what we are looking at covering in terms of the indicative content. So here, if I look at the indicative content given on the unit specification, we are looking at specialisms, the keyword, which is 3.1. Then we are looking at professions within those specialisms, and then what are the regulatory bodies which would basically set out rules and regulations related to some of these professions. So here we're going to be focused on some of the key acts and legislations which are passed in Parliament, and also look at one or two such regulatory bodies which then look at defining the basic set of rules in terms of how professionals within that particular specialism behave, offer their services, or conform to a code of conduct. That's the right word I would say, in terms of obviously delivering their duties. Now, before we get into this, what we want to be able to do is understand what are the specialisms, and then what are the areas in which we'll be looking at essentially, I would say, the specific roles. Now, the reason I say that in particular is because of the fact that when we do look at these specialisms, there's somebody who's playing with the screen, so I would request that that can be done away with. Otherwise, I'll have to block the permissions on my side here. So what my suggestion in that case would be that it's important for us to primarily ensure that we have a very good understanding of the specialisms in particular, and these specialisms then would be the ones that we'll drill a bit more deeper into, looking at the professions. Now, in order to do so, what I would suggest is, before I start the discussion, I want to visually actually show where do we find these specialisms, and within those specialisms, what are the various range of career options or professions that we can see within the NHS. Now, this is a website that I would suggest, if you are obviously using a PC or a laptop, this is what I would suggest that you need to look at opening up at your end. And what I'm going to do is obviously share my screen so that you're able to see what website I'm referring to and how do we go across, accessing this information. Now, when you look at this particular website which I put on, so what we are looking at is, when you click on the opening screen, you'd be able to see that these are the areas which primarily, are the specialisms within the health and social care sector. Now, there are lots of specialisms which are also listed here. So if you see allied healthcare professionals, you have the A&E team, dental teams, doctors, estate and facilities. We have large number of hospitals, and obviously different types of facilities, specialist facilities. So obviously that needs to be managed maintained, and obviously ensure that, like we know that in the NHS, in some of the hospital, MRSA virus or a strain is something which is a pain, because once this virus gets in, it is difficult to get rid, and that is why you look at the estate and facilities being maintained in a way wherein it minimizes the spread of infection. So there are lots of specialism areas. We look at health informatics, we look at healthcare science, healthcare workers, management, obviously, the NHS constitution, and the people who sit within the management team within each of hospitals, like the clinical director, the head of HR. You look at, for example, the chief executive, or the chief clinician and the chief nurse or the head nurse in that hospital. You look at them as people in management. Then you have midwifery, nursing, pharmacy. You have other services which support both health and social care, mental health care, and they would be, services which come under psychological professions. So here, if I look at an overview, when you click on that, it will show you what this specialism includes, what is the type of academic, let's say, degree or qualifications you need to work at this particular level, and then you can go into what the careers are, what are the pay scales and things like that, which are very clearly defined. Now, when we look at here in terms of professions, you're looking at people who work as consultants. There could be people who work within this role which offer therapy, and advice and guidance related to psychological disorders, substance misuse, alcohol, drugs, things like that. Then you have policy, which is public health, and then you have the wider healthcare team, which could be generic areas which are not covered in any of these specialisms. So this website is what I would suggest, just as a journal reading. You need to do. You need to look at going through all the professions and all the specialisms, and within the specialisms, the idea here would be, without getting biased, the idea would be to try and take a quiz, which is basically looking at find your best career. Now, this is a short quiz which the NHS has designed, because there are lots of things that I want to do or I want to take up in terms of working within the, say, health and social care sector. I might be very tempted to look at taking a small quiz, which will ask me a few set of questions, which will, obviously ask me questions about my skills, my abilities, my thoughts, my interests, and where is it that I want to be when I look at picking up a job or taking up or stepping into a job. And in such cases, this quiz will then recommend at the end of it the suitability in terms of career options that you can look at, or professions, as I would say, you could look at within the health and social care sector, or within specifically the NHS. So this quiz, I would suggest, as an exercise, as a I would say a bit of homework, I would suggest that everybody needs to take, and that would give you a very good idea in terms of what career professions would be best suited for you. This would not take more than 5 to 7 minutes to complete. Simple questions. So, what level of qualification are you hoping to have, or do you already have? So, if you click on some of the options towards the end, what it will do is basically, take you through a set of questions, and these questions would be having multiple choice options. You have to just read the question and, obviously respond. And once you answer these 50 questions towards the end of it, it will suggest you what are the most suitable career professions, or professions for you that you can take up to start a career within the National Health Service, and in a broader sense, the health and social care sector. So this is one of the websites which I would suggest that you need to look at. Now, in general, I know that I'm not too sure in general if people have studied some of the other units. And when you've studied some of the other units, what I would suggest is, in those units that you have studied, you would have studied units like human growth development, personal, professional values, and unit two, which is basically related to professional and person-centered values. You would have studied the personal and professional development in health and social care, and some of these units that you would have studied, would have essentially allowed you to um, essentially allowed you to get a bit more knowledge. Now, the reason I say that is because at the end of the day, when you look at reading through these units, there is some areas in particular that you are going to be able to, um, I would say, get a bit more knowledge on. Specifically, one of the units I think in which we talk about Unit 4, which is working within the health and social care sector. I think what you look at in that particular unit is there is Learning Outcome 6, which essentially talks about medication, administering medicine and things like that. So this particular website, again, I put on the slides and in the plenary slides towards the end, I would suggest that you should look at if you want to know about any health conditions, any type of health conditions, which an individual can have, you can go into this particular section, which is Health A to Z. And say, for example, if I look at diabetes, if I just go to the section D on the top, because there are so many conditions, illnesses, and things like that. If you want to read about a particular condition like dementia, diabetes, dengue fever, anything which comes to your mind, or things that you have gone through as illnesses or symptoms when you're growing up as a child, these are bits that you can look at in terms of general information. Obviously, there's lots to go through, but the idea here would be to try and go through this website to increase your knowledge, and this can be applied across Unit 4 and Unit 2 in particular. Now, if you want to look at Unit 4 in particular and the Learning Outcome 6, which was about medication and administering different type of medication, this particular site again on the home page, if you click on medicines A to Z, you can look at any sort of medication. Say, for example, let's look at paracetamol or paracetamol for adults. This is a medication, or piritones when everybody takes them during the summer months because of high concentration of pollen. And if you are allergic to pollen, you would be taking piritones. So, for example, if I look at paracetamol, it'll give you details about what is paracetamol, what are the side effects, and what the medication is generally about. And you can read about this on this particular website. This information is updated by the NHS quite regularly, and obviously it's useful from a point of view of finding out what this medication is for, what are the symptoms, what are the side effects, and who should be taking it, who should not be taking it. So this particular website is again a part of the NHS website when it opens up, and you can look this up for certain parts of information and for journal information and increasing your knowledge. Now, going back to our discussion, so I would suggest that at some stage after this session, my idea would be to ask you all of you to basically explore the different, specialisms and also the career options available, in terms of professions within by doing that particular quiz. So we will go into a bit of detailing now to understand what the learning outcome is and look at some of the assessment criteria. Now, one of the things that we need to look at in particular is when you talk about, what are the specialisms in the health and social care sector, we basically group them into certain categories. Now, if you recall, when we talked about three different types of care, we talked about primary care, secondary care, and tertiary care. Primary care is normally offered through pharmacies, GP surgeries, things like that, which are basically first, access that you get. You have secondary care, which could be primarily done in hospitals through the A&E team and, by the first responders. Then you have tertiary care, in which once you have discharged from the hospital, or if you had a clinical procedure or an operation, then after that, any sort of a care which could be given to you in your normal surroundings or natural, surroundings, essentially like your home, then that will be supported either by a team of specialists, which could include therapists, psychologists, things like that, and also healthcare workers. But that type of care would essentially be, provided at your place where you live, and that could be done through specialist teams, health and social care workers, and obviously the local authority and the community, healthcare service being involved. Now, when you look at that, and when we talk about further going into after you have received the care, then we go into what is called, different. This is something that we had covered in the first learning outcome. So we talked about primary care, secondary care and tertiary care. Obviously, as you know, the budgets for the mental health nursing and health and social care have been split across in the NHS after 2019. So we look at mental health care as a separate category, and here obviously if you have things like depression, you're suffering from anxiety or bipolar disorder, schizophrenia, dementia, things like that, then in such cases you require sustained services over a period of time to be able to do your normal day-to-day functions. And in such cases, you have people who would be supporting you or specialists who would be supporting you. And they would include people like psychiatrists, psychologists, counselors, mental health care nurses, or in some cases, specific facilities which you need to go to or attend to be able to, I would say, do your normal day-to-day functions. Then we look at pediatric care. And when we talk about pediatric care, this basically, is care given primarily for children, or from the care that the child gets from the time of birth to adolescence, which is what we studied yesterday when we talked about different stages of human growth development. And in such cases, when we look at 0 to 2, and then we look at your 0 to 5, and then we look at 6 to 12 or 13 until you reach adolescence. In such cases, any sort of care which is provided, which would allow, obviously it will be directly related to primary care, but also be preventative in nature. And in such cases, this would be termed under what is called pediatrics care. So the red book or the red diary, which I mentioned about, which is maintained initially up until the years of 5 till you go into primary school or nursery, essentially, would be all covered, and keeping track records of age, weight, height, growth of your body and organs, and any sort of conditions that you might have, and that will all be covered under what is called pediatric care. Now, people involved in this care would obviously be pediatricians. You look at pediatric nurses. You will sometimes also have psychologists and specialist consultants and therapists who would look after patients or children in this particular age, if they have, say, for example, genital disorders or disorders which they have inherited from birth. And in such cases, you would be, terming that care, or categorizing that care under pediatrics care. Now, when we talk about geriatrics, this is a term that we looked at when we talked about, what is geriatric care. So, in this case, when we look at the meaning of the word geriatric, it's basically, medical specialty that focuses on healthcare needs of older people or adults, essentially. So, pediatrics might be children up until the age when they reach 13 or get into adolescence. But when you look at geriatric care, here the idea is this care is primarily provided to individuals who are older adults, and in such cases, the idea is to create a balance between how they can improve their health, quality of life, and independence. Specifically, when we talk about the later adulthood, people after the age of 65, and in such cases, you would be looking at providing geriatric care. So a specialty form of care services, which primarily deals with obviously multiple conditions. And in some cases, if individuals have, say, for example, multiple diseases or disorders after they've reached a certain age of 65 and above, then in such cases, that form of care is termed as geriatric. So here, the idea is to perform and provide comprehensive medical care and services to people who are in, I would say, mature or older adulthood. Then we talked about palliative, care. And when we talk about palliative care, essentially, what we are looking at is care which is provided to individuals where it is focused on improving the quality of life, and also people who have terminal illnesses, or I would say life-threatening illnesses. And here, people would typically be, dependent on others. When I say others, I mean family and care professionals to be able to carry out their day-to-day functions. And in such cases, you would have hospices, care homes, and obviously the community working specifically with your family and the patients to be able to provide care. And that could not just include physical care, but it would include emotional, and in some cases, when I say spiritual needs, if assuming somebody has terminal illness and they're dealing with, the illness not getting better and obviously at some stage leading to loss of life, then in such cases, services related to bereavement and getting over that shock that people can sometimes get would be included towards the end of life care or palliative care. And then, if you've had an injury, an accident, or if you have gone through a serious life changing event which has affected you emotionally, mentally, physically, then in such cases, you would normally have rehabilitation or physical therapy, and that would be termed under another form of care, which will be rehabilitation and physical therapy, and that is to support individuals when they have had an injury or an illness or a life changing surgery. For example, somebody going through a heart bypass surgery, or somebody going through a hip replacement or a knee replacement surgery, then in such cases, apart from the physical repatriation or rehabilitation that the person needs to get, they would also need emotional and psychological support to be able to get better, get back to their independence and obviously full functionality in terms of day-to-day functions. And in such cases, you would normally have physiotherapist, occupational therapist, and obviously in some cases speech and language therapist, which will be specialist team of nurses, professionals who would be looking at providing this care, once the patient has had the surgery or the operation. Now, there are more such classification in terms of services which the health and social care sector provides. It includes things like public health and preventive care. So this is more about, I don't know if you've looked at various campaigns, which the NHS has run over the years, and they are basically aimed at promoting health and well-being. So these campaigns, whether it's for obesity, whether it's for better health, or it is to look at preventing people from getting cancer, heart diseases. There are loads and loads of such campaigns which essentially NHS runs, and that is normally run through PHE, Public Health England. And those particular campaigns, which typically run, say, for example, if you do a quick search on the internet, you would probably come up with campaigns like Dry January, which is to restrict the use of alcohol, because during Christmas, we indulge in maybe drinking and things like that because we are with family and friends. But just generally looking at, there are loads and loads of campaigns, which the health and social care sector runs, specifically NHS, and they could be related to cancer campaigns. They could be related to better healthcare campaigns in terms of heart conditions, diabetes, obesity. There are some of these campaigns which are then synchronized with the World Health Organization, which could be eating your five a day, which is something that we have seen on the national televisions. Better change for life, in terms of changing your lifestyle to basically reduce the BMI index, as we call it, body metabolism index. And in some cases looking at like the obesity campaign, which is being run almost throughout the year by the NHS, because it is all about preventing diseases. It's all about protecting and changing the lifestyles of how we eat and how do we consume food in order to reduce the chances of diagnosing or getting some of these diseases or illnesses in the future. Most important bit that we do keep talking about is community and social care. So community and social care services, are a key part of the NHS because they are involved in tertiary care that the National Health Service provides, and they would be done and delivered primarily through healthcare workers, which will support individuals to carry out their day-to-day activities, their activities like bathing, eating, changing, bits related to people which will essentially have some sort of disability, and they would additionally need some help from individuals to be able to carry out the day-to-day functions. So here we have social workers, we have community care assistants, support workers, personal assistants, who would come in and obviously provide this care, at your home or at your place of dwelling, which could be a care home, or an old age home. And in such cases, the idea is to help improve the quality of life which the individual is living, so that they feel independent and they are able to do most of their things on their own. We look at emergency and urgent care, which is normally the A&E services. Paramedics is essentially, you look at, sometimes we use the word locum, which is primarily a term which means that doctors, when they do, additional shifts or essentially do additional days, of emergency to carry out emergency work. So essentially, when you look at, they doing, say, for example, this in the context of, extra hours or shifts essentially under emergency, they would all be classified as, under emergency and urgent care. So a locum doctor might be, a medical, you will be classifying them as a medical professional who fills in for a temporary role. Say, for example, night shifts or in distance in remote areas. Sometimes, if you don't have access to GP surgeries or facilities, then in such cases, you would normally have a medical professional doing a locum, which is to look at filling in a gap or an absence. And in such cases, the idea of that particular facility would be to look at providing emergency and urgent care needed in certain areas. Now, there are a broad category of specialism that we look at, which is occupational health. And you have occupational therapists, psychologists, psychiatrists, all coming under that particular specialism. Here we are looking at people who provide, let's say, additional support to people when they are when they are under that rehabilitation process of after having been suffered an injury or having a major surgery. Occupational health in general would cover, health and safety of workers, and obviously people who work within the NHS and that kind of setup. And here you would be looking at, going through, for example, various set of individuals who look at risk assessments, health screenings, and obviously ensuring that if there is a risk associated to, say, a particular particular type of risk which is associated because of premises being unsafe or equipment not being safe, then in such cases they will look at creating mitigation plans to ensure that there is nobody put in the harm's way, whether it's patient, nurses, professionals who work within that setup, in terms of either contracting a disease or any form of illness or physical, safety. One of the things that we look at when we do talk about pediatrics is we look at, some sort of care also being given specifically towards neonatal care. And this would be, when I talk about neonatal care, what I mean by that is primarily care which is it is a specialized form of care which is given to babies who are born sick or, for example, premature birth. And in such cases, they are normally put or kept in neonatal units. So, for example, a normal pregnancy or a gestation lasts in humans for about 32 to 36 or 38 weeks. But if you have a premature birth because of emergency or because of conditions like
circulation for a cooler sleep.
So, sorry, any comments for everyone? Sorry. So if you have, say, for example, any conditions in such cases wherein you would have maybe a child being born before time, in such cases, you would look at also providing what is called neonatal care. And in such cases, if babies are born prematurely or in certain conditions, if it requires, specialist care, specifically for children. For example, you could be, a child could be born with abnormality. It could be a delivery which has happened prematurely, or it could be something related to, for example, a child born because if they are born prematurely, they could be underweight and things like that. In such cases or medical conditions, that would involve what is called neonatal care. Now, we all have been to dentist, and obviously dental care is one important part of maintaining our dental hygiene. And people who provide this particular care would be termed as dentists or, people, dental nurses, orthodontists, surgeons who basically perform some sort of, surgery on your teeth, and they would all be looking at, obviously providing dental care services. Then you have a range of pharmaceutical services. We have chemists and pharmacists, which will provide medication dispensing, subscriptions, repeat prescriptions, which are required by patients if they are on regular medication. And in such cases, you would generally see pharmaceutical care being provided. And again, here you'll have clinical pharmacists, which are based in hospitals. You have community pharmacists. You have pharmacists, which are based at the shop. And sometimes now for certain common disorders or problems, the GP surgery would normally recommend so for example, if I'm having cold and cough, I'm having fever or hay fever, then you can go to the local pharmacy and consult the pharmacist there to be able to advise you to what medication you need to have, because these are over the counter medications. They do not require prescriptions, and pharmacists would be able to assist with that. The list goes on, and the last few that we'd want to look at is people with learning disabilities and special needs, or SENS as we call them. And in such cases, you have again people who work and provide this specialist care, which could be both in the form of primary care, education, care which is required to do some essential functions. And in such cases, you have disability nurses, people who are trained to deal with people who have disabilities or SENS as a condition, would be involved. And in such cases, if you have people involved providing and care to children at the early age, they are normally also referred to as early years practitioners, EYE. And in such cases, they would be providing the support needed for the individuals to be able to function and carry on with their day-to-day routines. We also have one specialism which specifically deals with substance misuse and addiction services. This is again a branch within the National Health Service also, wherein you would have specialist professionals like counselors, consultants, nurses, and even clinicians who would offer, both psychological and psychiatric support to people who are, addicted to certain type of drugs or conditions. And in such cases, they go through a process of detoxification and rehabilitation. And this is handled, or as a specialism, handled by the substance misuse and addiction services team within the health and social care sector. Obesity and maintaining BMI is becoming a big challenge within the NHS, and a lot of budget within the National Health Service is now being deployed towards PHE, Public Health England, to ensure that prevention is better than care, as they call it. So what we are looking at is education through training, through programs, through workshops, is being also organized on a regular basis to ensure that certain conditions which we know can now develop because of obesity, like diabetes, heart conditions, cardiac diseases in particular, there is a focus within the health and social care sector and the budgeting that the government does to ensure that people know how to eat healthy, how to balance their diet in terms of eating 5 a day, for example. That campaign, which has been running now for a number of years, is aimed at ensuring that we deal with certain problems which can lead to chronic conditions in the future. But apart, that is one aspect. The second important aspect would be people who undergo some sort of surgery, operation, life-changing, events. Then in such cases, they would sometimes need, advice and guidance on, looking at making a difference or a change in their lifestyle, to avoid such conditions or illnesses in the future. In such cases, you would look at nutrition and dietary services, which would be a specialism. I mean, here the guidance would be provided primarily to ensure that you're able to eat healthy, you're able to eat a balanced diet, and that hopefully helps reduce, any sort of illnesses or disorders that could be genetic. That is something which you could be more susceptible to getting because of your family history. And the idea there is the NHS and the health service works with you to provide guidance to maintain a healthy, eating routine with regards to the specialism, which is nutrition and dietary requirements, things like that. So when we do talk about specialisms, if I look at the NHS website, which I've shown you, there are about 17 different specialisms that we can go through, 17 or 20 of them that we can go through. And these specialisms essentially all put together provide pediatric, geriatric, maternity, neonatal, mental health, social care across to the members of public. So that is what we need to understand in this particular learning outcome. So this is just an overview of that, and now we'll get into some of the assessment criteria to go into detailing of understanding the specialisms, and then followed by professions, and then looking at the last, which is how these professions are regulated. So any questions on this so far? Any questions from anybody? Is this all okay? Everybody's clear on what I've said and explained so far?
Yes, please write on.
Okay, great. So let's look at now going into some of the assessment criteria, which might be a slight bit of repeat. So I'll go through some bits of it quite quickly. Now, the first one talks about specialist areas within health and social care. So here, what we are looking at is talking about these specialist areas that we have gone into a bit of detail. But here, what we have added, because it talks about analysis, is that we need to be able to discuss in a bit more detail what this specialism consists of and what kind of roles are within that specialism possible, and what is the day-to-day responsibility or the areas in which this role performs the responsibility. So we have understood the specialism areas broadly when I looked at some of the discussion for learning outcome, but here we are going to be going into the third level of detail, which is talking about the specialism, talking about the roles, but at the same time talking what roles and responsibilities these specialisms do and what kind of career options which these specialisms provide. So we'll look at primary care. Now, primary care, most important because this is where you have a first contact. When you have a problem, for example, if I'm running fever for a couple of days, the first point of contact with me that I would do is primarily call up my surgery, go to the pharmacy, and get myself checked. And that could involve, for example, taking my blood pressure, looking at my temperature, taking my temperature, looking at my blood pressure. If I have any conditions like diabetes, then my bloods will also be done. If the blood pressure and the temperature and some of the other visual signs come out okay, then at some stage the GP or the pharmacist essentially will say that you need to see your GP, and when you go and see your GP, they would recommend further investigation into it, and that could be in the form of obviously meeting you face to face, but apart from that also having to go through some of the basic set of tests like blood pressure, looking at journal symptoms, physical symptoms on your body, and also asking you questions. Now, in such cases, if that was the instance, then it would be termed as what is called primary care, because here it is the first point of contact that I'm going to have with a specialist person, or somebody who's going to diagnose what is the problem with me or the problem that I'm having. And in such cases, they would be the ones, when I say they, I mean the doctor or the clinical nurse that you meet at the surgery would be responsible for, obviously giving you medication or suggesting further tests that would be carried out in order to diagnose what is the illness and what are the symptoms and what are the illness, why is it being caused, and what is it that you need to receive in terms of medication. Now, secondary care, I've explained earlier, would be essentially related to, when you need, say, for example, you go into hospitals essentially and you need some sort of, specialist care, which could be related to you undergoing further tests. I think a good example here would be, say, if you had chest pain, you would go into your GP surgery. That would be the primary care. The GP would do some tests, and if they still feel that no, this is being caused and you are having angina or something like that, then straight away they will rush you to A&E. When you reach A&E, again further tests will be done, and that would constitute secondary care, because the first responders would essentially carry out other tests like ECG, look at electrocardiogram, look at troponin levels in your blood, simply because they would want to detect or weed out the possibility of somebody having a heart attack. And if that is detected, then you would go into detailed secondary care, which is looking at further investigation. And that could be MRI scan or an ECG, which is happening, or an electrocardiogram, and they will all be a part of the secondary care, wherein specialists would get involved, consultants would get involved, or doctors who are cardiologists and things like that would get involved. And if you are diagnosed with a condition or a blockage, or for example, a serious condition wherein you've had a blockage and you've had a heart attack, then in such cases you would undergo surgery, and that'll all be secondary care. After you had the surgery, you'll go into tertiary care, which is rehabilitation, getting back to the normal life in terms of your daily routine and the functions that you do. So here we have these seven basic areas that we've discussed, and that is what is required to be discussed in this first particular assessment criteria. So I'm not going to go into all of them. So looking at mental health care, pediatric and geriatric care, looking at palliative care, and then rehabilitation and physical therapy. Now, in addition to this, we've added others, which is public health and preventive care, gone into detailing of that, which is here on this particular slide. If you see slide 8 onwards. So I've gone into a bit of detailing here so that you understand all the different specialisms from a point of view of what is the specialism, what is the role and importance, what are the challenges or they face, and who are the set of individuals which will provide that service is being detailed out in obviously these slides. So these are all the different types that I would suggest that we need to cover in the first assessment criteria, which is analyze different specialist areas within health and social care. Now, you could cover all the 17, you could cover a few, which is, 4 or 5 that you feel comfortable with, and then you detail them out, and that would help you meet that particular assessment criteria. By no way you need to cover all the 17. I've only done 14 here, and I stopped because it was a bit repetitive. But at the same time, when you do your assignments later, I think what you're looking at is, because it's asking for analysis, you'll have to look at picking up a few areas and explain why they are a specialism, what type of support they provide or services they provide, and who are the professionals involved in that, and what are the challenges that they face. Because analysis is all about building arguments. So you have to look at challenges, you have to look at responsibility, their contribution towards it, and that would help you cover this particular assessment criteria. So any questions on this? The second one that we are looking at covering is a range of professions. So after the specialisms, we want to, if we look at 14 or 17 specialisms that we've discussed, what we want to go into is these specific professions. And within those specific professions, what we want to be able to do is look at the roles or professions in detail. So one such, I've obviously listed out a couple of them. I've started out with a GP or a doctor. Then I've gone into a nurse and a social worker. What is the role? What is the responsibility? And what is the kind of services they offer in this particular profession? So I've taken a physiotherapist, occupational therapist, mental health care counselors, psychologists, pharmacists, dietitians, paramedics, radiographer, for example, speech and language therapists, midwives, and then I've covered a few more. Now, the best way to read and understand this in terms of professions would be to go up to the NHS website, which I've shown earlier. Look at a particular role. First, look at the overview, because if you are looking at doctors, obviously, what is the role of the doctors? What are the various different specialisms that you can become a doctor in? GP is one such specialism, cardiologist is another one, neurologist is another one, orthodontist is another one, which deals with bones and problems or things related to bones. You have gynecologist. So there are various specialisms as far as doctors are concerned as well. How do you train? And this would be a good site for you to look at. Now, if you want to look at the roles, these are the various kind of roles. So an anesthesiast, for example, is a person which is present normally within the operation theater. That person is responsible for, assuming if you're having a major operation, you have to be given general anesthesia. then in that case, that person would be would be basically putting you to sleep, and the responsibility of that person would be to bring you back from the sleep when the operation is over, to ensure that your heartbeat, clotting, heart is beating normally during the course of that operative procedure, making sure that there are no clots being formed, and ensuring that the person is being able, the after the operative procedure is over, the person is able to be this role of this person as a specialist doctor would be to help make sure that the patient is then revived back slowly after the after the influence of general anesthesia is over, and there are no conditions or side effects to that particular general anesthetic. So in such cases, the idea would be to look at the detailing of that particular role, because what we are talking about in this is describing a range of health and social care professions. Now, there are loads and loads of professions. So if you look at specialisms, if there are 17 of them, then within those specialisms there are 350 different professions. So here the idea would be to pick out two or three which you can actually relate to. For example, I don't know if you can relate that to. For example, I've never ended up using an A&E service or an ambulance services, so I might not pick that up. But I've been to a dentist. I've also had, I've also been to a doctor, GP. In some cases, I might also look at a clinical nurse or a clinician who has given me some advice, which normally, can be for over the counter medicines. I might have gone into the pharmacist to take some advice, and these could be the professions that you talk about when you describe this particular, or describe and obviously cover this particular task, which is the second assessment criteria, which talks about describing what are the various range of professions that you see within this sector. Now, nursing is one of them. A lot of us have met nurses, understand what they do and what they carry out in their day-to-day responsibilities, and that would be the bits that you would need to describe when you look at covering assessment criteria 3.2. So this, I would suggest, try and relate it to your interest or an area which you are familiar of, because of the fact that you have either been in touch with that person or have used their services and can relate to understanding what they do, what their roles and responsibilities are, and at the same time, where they work, and how they work, or what academic qualifications they would need to have to be able to work in that profession. Is that okay? Any questions on this so far? I think it's simple, but what I would suggest, again, the basic bit of reading that you need to do, which is on the website, to get a good grasp on the detailing of the profession and obviously the role that they perform in that profession. Now, the last one talks about, outlining how do these professions get regulated. So here we need to be talking about, regulatory bodies which essentially set the standards and obviously manage licensing, and obviously establish the code of conduct, monitoring and compliance with these policies and procedures, acts and legislation which are set, that all professionals and bodies, all professionals and setups, I would say, need to conform with when they are offering these services to the member of publics. So there are lots and lots of bodies, but I have listed down a few which in their order of relevance. So we are aware of, say, for example, General Medical Council. This is a council which basically regulates, sets the code of practice or standard and policies and procedures for doctors. So General Medical Association, or GMC, General Medical Council as we call it, regulates anybody who has a doctor's license in the UK or has become a MBBS doctor, and they ensure that they are compliant with, you know while offering services to the members of public, they are compliant with the basic set of procedures, processes and policies which are required to provide that quality of service when they are designated as a doctor. So they look at professional conduct. I think in the news, if you have been tuned in over the years, we have seen a number of such cases being brought across against different doctors, taking them out, striking them off essentially from the medical council because they have, not adhered to the guidelines, or their policies and practices, or the practice that they have done has led to a number of deaths or serious, after effects for patients once they've received the treatment. And in such cases, it is, one of the things that the General Medical Council does is strikes the doctor off from the register. But in serious cases, it can also lead to criminal investigations and even, you know, terms, some sort of jail terms for doctors or medical professionals under the GMC, people who are qualified as general practitioners or consultants. They can be barred from practicing in the future within the UK, and that this council actually looks at that regulation, making sure that the people who are designated as professionals as doctors are conforming to the practices which have been laid down by the General Medical Council. Then you have the same applicable for nursing and midwifery. Here, obviously, they look at regulating the nursing and midwifery sector. They are responsible for obviously legislation, regulation, monitoring, and compliance. When you are registered with the Register of Licensed Nurses and Midwives, that requires a revalidation every 3 years. For the GMC, it's I think 5 years. And they also look at independently carrying out investigations if they find any serious flaws or complaints from patients who have received services from nurses or midwives. So this is the second important, I would say, regulatory body which looks at, uh, I would say, accessing or regulating some of the professions that we've discussed in assessment criteria 3.2. The third one that I'm going to just briefly mention is the Health and Care Professionals Council, HCPC. A lot of us will work as healthcare professionals within this sector, whether it's social workers, healthcare assistants. You would be involved. And apart from that, when you look at the various other professions, specialisms it covers allied health professionals, including physiotherapists, occupational therapists, radiographers, paramedics, speech and language therapists. So here, their part of the role is to also look at the same, to maintain the code of conduct, to look at maintaining compliance, and ensuring that they protect public, or ensure that the procedures and policies which are implemented by healthcare professionals are going to be safe for the members of public. And in some cases, if you're offering these services privately, then you'd also be required to apply for licenses, and these licenses and renewals, inspections, to ensure that you're conducting and maintaining the policies and standards as per their code of conduct, would be the responsibility of Health and Care Professionals Council, or HCPC. Now, I've listed down in the slides some of the important regulatory bodies which will basically be looking at monitoring and regulating and ensuring that compliance within these professions are maintained. And they would include, like, the Journal Pharmaceutical Council. You'd also have, say, for example, Journal Dental Council, which will be for dentists, dental hygienists, or dental technicians. You'll have the Quality Care Commission, which is quite important because this is the body which basically creates, all the policies and procedures which hospitals, any sort of a department within the NHS has to conform with, and they are regulated by that. So, as Care Quality Commission is an independent regulator. It is a non-government body, or a semi-government body based in England, and it basically looks at ensuring that health and social care services are safe, effective, and obviously provided, as per the legislation and acts which have been set within this particular sector. Now, anybody or any body or any, say, for example, organization which is offering any sort of health and social care services have to be registered with CQC. They are regularly inspected, they are regularly monitored, and obviously the findings of the reports in terms of inspections are published on the CQC website. Now, if the services are not meeting the standard, they are not meeting the care standards which have been defined by CQC, then in such cases, CQC can either put them under some sort of, an action plan, can even withdraw services and withdraw the license or revoke the license for them to be able to operate in the market. Now, they are essentially a governmental body, but it is under the Department of Health and Social Care from a jurisdiction point of view, and their role is primarily to look at ensuring that the services which private public sector provides are to the members of public and are classified under the health and social care services are safe, effective, and driven by quality in terms of standards which are set in the CQC manual. So these are bodies which regulate different professions within this particular sector. Now, there are 17 professionalisms, specialisms, sorry, and again, there would be a number of bodies which basically, act as regulators. So again, the idea here is because it's talking about outlining, we are not going into very much detailing of, the regulatory bodies. We're talking about what they are, who they are essentially, what they regulate, and what are the key requirements for maintaining and ensuring that the health and social care services are safe, effective, and quality driven as per the guidelines set by either acts or these regulatory bodies. That is what you need to cover in this particular assessment criteria. It is about outlining. You would be basically writing one paragraph of 30 to 50 words by picking out three or four regulatory bodies that you are more aware of, or in general are the most important bodies like GMC, NMC, HCPC, CQC, and General Dental Council, for example, if I would put them in some sort of order of priority, and they would be good enough for you to complete this merit criteria. Is that okay? Any questions on this so far? Now, I have put these important websites that I've shown you in the plenary site so that you are able to, get access to these websites for additional reading. And that would give you a comprehensive understanding of Learning Outcome 3, which talks about understanding the different areas of specialism and professions, and these professions then being managed and regulated by various regulatory and legislative bodies and acts, and that is what is covered in this particular outcome that we need to understand. So I hope this session has been useful, and if you have any questions, please feel free to ask me now. Right. If there are no questions, then I'm going to try and end this session, and I'm going to catch up with you, next Wednesday, wherein we'll be discussing Learning Outcome 4. And then on subsequently Friday, we'll be looking at doing an assignment discussion on this unit. So I'll make sure that the copy of the recording is pasted. The link to the recording is available to you on WhatsApp. And then the link of that will also go onto the Moodle platform so that you're able to access it later should you wish to do so. So thank you so much for attending.
Thank you. Thank you very much.
Bye for now.
Bye.
Bye.